Fortunately, there's nothing I can add in here at Mayo right now.
Okay, I need you to send me over to whoever handles your guys' administrative complaints. I'm sorry, and your name is Jason?
Yeah. Jason.
Yeah, how about you yeah, please.
Okay. Let me just pull that number up here. Just gonna go through. Okay, I have that number. Would you like to have that number as well for future reference?
Yeah, if you could give it to me, I can write it down, and then if you could possibly transfer me, that would be appreciated.
Yeah, I can transfer you and give you that number.
And then also, where do you guys do your complaints against providers? Like your RNs, like Miss Jennifer Larson?
This would be the perfect place for that as well. It's our Office of Patient Experience, so that would be the perfect place to do that for as well.
Okay, maybe we'll try the Office of Professional Responsibility too for the state, for their license as well, but I already have that one.
Okay. I have that number whenever you're ready here.
Great, go ahead and give it to me. Thank you, Jason.
Okay. 844-544-0036.
Okay, and then what's your title? Are you a scheduler? Or are you an actual
I'm
internist?
a patient appointment specialist. I'm a scheduler.
Okay. All right, and then you can transfer me too, correct?
Yep, I'll transfer you right now.
Thank you.
Yep, no problem. I actually got to type it in just a little bit differently. It didn't want me to do it the way it did.
Okay.
Mayo Clinic's Office of Patient Experience. If this is a medical emergency, please hang up and dial 911. For questions pertaining to your bill, please say billing or press 1. For questions about travel, lodging, community resources, and events, please say concierge or press 2. For all other Mayo Clinic Experience inquiries, say experience or remain on the line. Your call is important to us. Please hold while we connect you to the next available representative. To ensure the needs of the patient come first, your call may be recorded for quality excellence. All of our representatives are assisting other callers at this time. Please hold and we'll be with you momentarily.
Yeah, Jennifer Larson is Tony's name that she uses when she practices as a fucking RN or a certified nurse practitioner. She shouldn't have fucking had anything to do with it. She's the one who did my sexual assault kit. And she was the one who was forcing me to not have the police come to the fucking clinic.
All of our representatives are assisting other callers at this time. Please hold and we'll be with you momentarily.
Tony pimps her fucking African kids out to sick doctors that have HIV. I don't know, but somebody should fucking kill her. And she uses other people's information to get fucking medication so it doesn't have to go under her kids' information so she doesn't get caught for what she's doing. Quar Rundial.
Good afternoon, Office of Patient Experience. This is Angie. How can I help you?
Hi, Angie. Do you need my MRN number or anything to pull up my file?
I can certainly take it.
Okay, it's going to be 9149863. And I'm calling because... All right,
your name and date of birth, please?
Yep, Samantha Gale, 82385.
Okay, and can you verify your address, please?
Yeah, lot 2185, box 17370, St. Paul, Minnesota, 55117.
Okay, perfect. And how can I help you?
I'm calling because I'd like to file a complaint about your office refusing to provide me care that's actually required to be provided by your office, as well as refusing to give me an entire full prescription for an HIV medication, which CDC requires a 28-day supply be issued, and your providers only issued me 5 days and then took the other remainder, I think a 25-day supply, and I don't know where they issued it at, but I didn't get it. And now they're refusing to give me a follow-up appointment so that I can...
What kind of medication?
Truvada and, let me see, emtricitabine, tenofovir. Those are 2 medications you're supposed to have after HIV exposure that stop you from getting the disease.
Okay, and what medications were you wanting?
There's 2 of them. There's, what the hell?
Okay.
One of them is Truvada. I'm supposed to have another 28-day supply of it. And then the other one is going to be emtricitabine tenofovir. I don't know how you say that, but it's 300 milligram tablets and then 50 for the Truvada, or whatever the generic version is. But your office is refusing to provide me... Yeah. I was seeing at your guys' clinic. If you pull it up...
Okay, and when were you seen?
I was seen on July 3rd, and I requested that they do not let Jennifer Larson have any access to anything with my healthcare information. She shouldn't have access to my Epic. She shouldn't have access to my MRN. And I went ahead and notified your staff verbally, and I also did in writing. And they're saying she's the only person that can have an appointment.
I don't know. I'm not sure what you're talking about. My staff and patient experience, you've told who?
The scheduling office. Your schedulers.
Okay, and this isn't the scheduling office. This is patient experience.
Yep, and I'm telling you about my experience. And I'm telling you about my experience with the scheduling office, okay?
In what department?
Infectious disease. Is this how you guys treat every...
You were seen
Okay.
You were seen in the ER.
Stop talking for a minute and I'll give you a brief little overview so you can understand. Like, this might help. Okay, on July 3rd, I went in for a sexual assault kit at the Mayo Clinic in Austin, Minnesota. The provider there was, let me see what the hell her name was. It's Elizabeth Fogelson. She should have issued me, based on CDC guidelines, a 28-day supply of 2 medications that stop any kind of infection from any HIV exposure. She only gave me a 5-day supply. Now, when I called to follow up with infectious disease, which is what is sitting here on your guys' print off, they give you the after visit summary, said I needed to follow up with infectious disease, which I did try to do today. You guys haven't been able, the schedulers are refusing to put me on the schedule or on the calendar for any other provider. They're saying the only provider that they can put me on is Jennifer Larson. And Jennifer Larson is not one of your infectious disease providers that handles HIV exposure. And also, Jennifer Larson, as I said, should not have any access to my MyChart because it is a conflict of interest due to our previous relationship. So when I called in to talk to your guys' scheduler, they said that they're going to send me over to you because they can't provide the care that they're legally required to provide, which they should have on the 3rd, and I wouldn't have to be calling you guys up. That's my problem right now. That's why I'm on the phone with you right now.
So infectious disease told you to call me because they can't provide you care?
No, the scheduler did. The scheduler is trying to play God here with my life.
They can't.
Do you want the recorded?
They can't provide you an appointment.
Yeah, she's saying that she can't provide. Both. Actually, there's 2 people. There's Callie, and then there was one named Jason. I'll go ahead and email you guys the audio of the phone call. Especially considering this is a sexual assault case. And you guys are the only sexual assault providers in the state besides the one in St. Cloud. I really feel like your people may have dropped the ball on this one.
And who's Jennifer Larson? That's the doctor that they're trying to schedule you with?
Yeah, and she's not supposed to have any access to my information because, number one, she doesn't work with infectious disease for you guys at any clinic. And number two, I have a previous relationship with her outside of Mayo Clinic, like on a personal level. So it's a conflict of interest. She shouldn't be having any kind of access to anything with my chart at all. Which I notified your schedulers of that, and they're refusing to put me on the calendar for anybody else. And I have the audio of that call, which I will go ahead and email to you.
I don't need it.
And here's my problem, okay? The 5-day supply they gave me is going to run out this weekend. And this medication, just like I told you, CDC requires you have a full 28-day supply, not missing any doses. Otherwise, if you are exposed to HIV, which I was, you are guaranteed to be positive. So, like I said, you guys have a scheduler there that's trying to play God with my life. And I really think that it is not in your guys' best interest to continue to do so. You guys have to have somebody for me to be able to see because these are the requirements. Like CDC has requirements, and you guys are the only people that handle sexual assault cases.
I can certainly share your concerns.
Mm-hmm.
So help me understand. So this is
I already explained it to you.
Emergency department visit. You feel
yeah. There's a rape kit that was done.
To understand.
I just explained it. Yeah.
Am I allowed to ask you any questions?
Yeah. Just go ahead.
Okay, thank you. So help me understand. So you're saying that Dr. Fogelson that's seen you in the ER did not provide you with enough medication. That's what I'm trying to ask.
Yes. And they're refusing to refill the medication because they say that I have to have a follow-up appointment with infectious disease, which is with your guys' office, which your schedulers, Callie and Jason, both declined to provide me an appointment on an audio recorded call, knowing that my prescription ran out this weekend, like tomorrow.
So they're refusing to refill your script until you are seen in infectious disease.
Yes, and
that's
your guys'
the pharmacy is telling you, or who told you that?
That's what the pharmacy is telling me. That's what your guys' pharmacy is, the one for Mayo. And they shouldn't even have done that. They should have gave me a straight 28-day supply. If you go to the CDC website, they have specific guidelines that you're supposed to follow regarding any kind of HIV exposure. It's not supposed to be just, you're not supposed to take 5 pills and give it to somebody. You're supposed to give them the entire supply because it is considered a life-saving medication. And your guys' pharmacy qualifies for those kind of medications for free, regardless of whether insurance is billed or not. That's why I'm saying your office really did drop the ball on this one and is continuing to. And if I don't get the remainder of this supply, I was exposed to HIV. So if I end up positive, that's going to mean that your guys' provider, your guys' office is going to be responsible for that. That's why I'm saying, is there a way that you could talk to your schedulers, actually talk to infectious disease and not the receptionist that's handling appointments so that I can get a appointment scheduled so that I can get the remainder of my prescription filled?
I can share with you that you're calling patient experience. My role is to share your concerns with the department. I am not infectious disease.
No, but you can talk to them, correct? Right?
My process, Samantha, my process can take anywhere from a couple weeks to a month. It doesn't typically take that long, but I like to let patients know that it can. My role is to share your concerns.
Okay. Is there a way that you can make it go a little bit quicker?
This with them.
Is there a way that you can make it go any quicker?
I can definitely share this with them. No, I can't. I'm sorry.
Okay.
I can share your concerns with the department and reach out to them.
And what's your name and your title?
My name is Angie. I'm a patient experience specialist.
Okay.
My role is to share your concerns.
Okay, and you work for the Rochester Mayo Clinic. Can you tell me which office you work for?
I work for patient experience. That's who you called, correct?
At which clinic, though?
We are an enterprise line.
Okay, are you an employee of Mayo Clinic Rochester, Mankato, Austin,
Yes.
Minneapolis? No.
Rochester.
Okay, and are you an employee of Mayo Clinic?
I am employed at Mayo Clinic. That's who you called, correct?
Okay, you want to go through this? Because I can definitely guarantee that you're going to be pulled into litigation and you won't be employed very soon.
Okay. I can certainly share your concerns.
Great. Can you please send me over to infectious disease?
I can certainly get you to the operator that can get you to infectious disease.
Great. Thank you so much.
Yep. Please hold.